1082 as read out and sums allocated in the schedule be approved. Honorable Junet, what is out of order? Yeah, that's not a point.
Thank you very much. I don't understand, or I don't want to believe that health is devolved. Chair, if we are giving Ministry of Medical Services 102 billion and Ministry of Public Service 28 billion, a total of 160 billion, and we are claiming here as a country that health is a devolved function, why is this money being kept in Nairobi to do what? When you know that health is a devolved function, 30 billion shillings is enough to run the Ministry of Medical Services, Madam Chair. Madam Chair, if this is money for the big men and women of Nairobi, then let us just agree that Parliament is passing this money for the big boys. Otherwise, why should we keep 160 billion shillings in Nairobi when the function is devolved constitutionally in the Constitution, fully devolved? That's why doctors are striking, medical people are striking, clinical people are striking, because we are misdirecting their money to something else. Madam Chair, let us reduce this budget to 20 or 30 billion and devolve this money to the counties. People who need services, medical services, are in the counties. They're not in Nairobi. Why do you want to have Afia House to have 140 billion when a county like Kiambu and Muranga are only having 2 billion for health services, Madam Chair?
Thank you.
We cannot.
Member for Mandera North.
Chair, thank you very much. Chair, when I look at the sum allocated for State Department for Medical Services, it is 102 billion. We all know health is devolved. The last time the Ministry of Health has done infrastructure developments or something in the counties, I don't even remember it, so before devolution. So why will this money be at the headquarters when we know that health services are also devolved? Is there also issues or certain aspects whereby this money will help each constituency in terms of health facilities? If that is the case, we will have no problem, but there are no provisions for that. And I'm sure Chair Health is sitting here and he understands. We do not have any money allocated or helping us in the constituencies for health services from the Ministry of Health.
Okay, thank you.
All the constituency require is they get the money from the county governments. So we need also this money to go down to all the constituencies. Thank you.
Honorable Member for Thika. If you're not on this, kindly remove from the intervention so that we can give members a chance.
I'm not for this. Let me remove the intervention. Thank you.
Thank you. Honorable Member for Mogotio.
Thank you, Chair. And before that, I must put into record that I'm a member of the Health Committee and I'm a part of those who sat for this budget for the Health Committee, Madam Chair. Madam Chair, it is fair to let Junet Mohammed know that Kemri is part of this budget, and the Kemri sits in national government. KEMSA, which get drugs to give to this county, sits in national government. KUTRH, Kenyatta Hospital, Moi Riverol, and Chief and the Shah sit in national government. Before he start, these professional bodies dealing with the elderly, including the KMPDU and the rest, sit in national government. So before my brother Junet say it should be reduced to 30 billion or so, he should ask himself, where does this money go? And where does this money go in terms of services? If you talk about KUTRH and
Honorable Farah.
Madam Chair, Madam Chair, we have a problem in this country. We are complaining about money being wasted through corruption at the center. The little that we have taken to the periphery is also being misused in a manner you cannot imagine. I remember when the fellow who's sitting next to me, Professor Nyikal, was the Director of Medical Services here. And we are much, much better off. Can we have kind of a middle ground in which the only way we can stop this wastage is not to choose between two ills or two evils, but to create a national health management service or commission, whatever. A national health commission, which is going to take care of, like the UK. UK has got what you call the National Health Services. So let's have that independent body, which is run by professionals, people in the field of medicine itself, who will be able to, a doctor has got a Hippocratic oath, and worries about saving lives. It doesn't matter what part of the world he comes from. He could come from the most capitalist, most things, but at the same time, he will take care of this. So let us change this. Let us not choose between two evils. We have a serious problem in provision of health services at the county levels today. And the only way we can do it is that we get away from the center, but we also create this national, health commission that's going to take care of it.
Thank you. Member Honorable Dan Mwashako.
Thank you, Madam Chair. I stand to support this, but as I do, Honorable Chair, I want to agree that this country, we must honestly make a decision when it comes to how much money should remain in the center and how much needs to go to the devolved counties, so that, Chair, we can offer the best services to our people. But Chair, having said this, I want also to say that the number of referral hospitals in this country are too few. We may need to only have Kenyatta National Hospital, we have KU, and have Moi, and we have Madare for the Madare. But I think we need to have more hospitals, one in the coast region, one in north and eastern, so that, Chair, our people can continue to get these services, specialized services when required. Thank you, Chair.
Honorable Elachi.
Thank you, Chair. Chair, while we support, I think for us as women, my question will just be, as we increase this, we've removed Linda Mama, yes. Is it part of the seed money for SHIF that will now assist the women to go back in the program they had? And is it possible through the same program to bring in now our children, because we don't have EDU, so that they can also get into SHIF that will assist them when they are sick in school, Madam Speaker. And also on the issue of a maternal newborn child and adolescents. You see, when we bulk adolescents, and we are not even saying how the ministry is going to help these adolescents, also it leaves it so vague. The problem is not the figure. The problem, Madam Chair, is how the services have been now coded. And so everyone is left wondering which code is going to shift, how much is the seed money. If that was there, I don't think any Kenyan will have an issue with this, Madam Speaker.
Thank you, Honorable Jamatia.
Thank you so much, Madam Chair. And I also want to add my voice on this, that the money that we have allocated to medical services is quite a lot of money, considering that most of the services, as most members have said, is actually deteriorating in our hospitals, health centers, and specifically the programs like Linda Mama, which was actually affected so much because of the change of programs. And as much as I understand, this money is always appropriated depending on the needs. And the national bodies like the referrals, as much as they need the money, we should also consider the lowest pyramid where most of this money should be going. I think as much as we are discussing this, the need is more dire in the ground or in the low levels than in the national levels, because these are institutions that are always getting money all the time. Thank you, Madam Chair.
Chair, Health Committee.
Thank you, Madam Chair. Madam Chair, when you read the fourth schedule of our Constitution, the Constitution gives the national government all national referral facilities. It also gives policy. And when you look at this budget takes care of all the referral facilities. Among them, Madare, which is a special mental hospital, Kenyatta National Hospital, Moi Teaching and Referral Hospital, Kenyatta University Teaching and Referral Hospital, Spinal Hospital, and then we talk of other institutions like National Cancer Institute, we talk of Kenya Medical Research, KEMRI, and then we talk of KEMSA. All that budget is here. So when members refer to it that the health has been devolved, I think it is not, you are not referring to the Constitution, because the Constitution clearly defines. And this money which has been allocated as 102 is actually inadequate to provide adequate services within those institutions. Honorable Speaker, I've seen the concerns raised by the members. Among them is the issue about Linda Mama. Linda Mama is actually taken care of in this. Recently, we also had issues about vaccines in the country that have not been paid. We've not paid our counterpart funding, which is normally quarterly about 2.5 billion. That money has also been factored in this. This has also taken care of provision of vaccines within the country, and these are normally centrally procured for all the country, because this is donor-funded programs. You also have other programs like HIV/AIDS, drugs, and many other programs that are centrally organized through this budget. So the budget is actually inadequate for us to meet those demands. With those few remarks, Honorable Chair, I want to support.
Thank you. I will now put the question that the programs under the vote 1082 be, as read out and sums allocated in the schedule, be approved. I now put the question that a sum not exceeding 102,983,407,719 Kenya shillings be issued from the consolidated fund to complete the sum necessary to meet the recurrent and development expenditure during the year ending 30th June 2025 in respect to vote 1082. As many as are of that opinion say aye. As many as are of a contrary opinion say nay. The ayes have it.
Vote 1083, State Department for Public Health and Professional Standards.
I propose the question that a sum not exceeding 28,037,735,123 Kenya shillings be issued from the consolidated fund to complete the sum necessary to meet the recurrent and development expenditure during the year ending 30th June 2025 in respect of vote 1083.
Programs under vote 1083, Preventive and Promotive Health Services, Health Resource Development and Innovation, Health Policies, Standards and Regulations, and General Administration.
I propose the question that the programs under vote 1083 as read out and sums allocated in the schedule be approved. I put the question that the programs under the vote 1083 as read out and sums allocated in the schedule be approved. I now put the question that a sum not exceeding Kenya shillings 28,37,735,123 be issued from the consolidated fund to complete the sum necessary to meet the recurrent and development expenditure during the year ending 30th June 2025 in respect of vote 1083. As many as are of that opinion say aye. As many as are of a contrary opinion say nay. The ayes have it.
Vote 1091, State Department for Roads.
I propose the question that a sum not exceeding 51,631,203,200. I beg your pardon. I put the question that a sum not exceeding Kenya shillings 51,631,203,728 be issued from the consolidated fund to complete the sum necessary to meet the recurrent and development expenditure during the year ending 30th June 2025 in respect of vote 1091. I beg your pardon, members, that typo is on mine. We'll go with the order paper. I propose the question that a sum not exceeding Kenya shillings 199,361,988,075 Kenya shillings be issued from the consolidated fund to complete the sum necessary to meet the recurrent and development expenditure during the year ending 30th June 2025 in respect of vote 1091.
Programs under the vote, road transport, general administration, planning and support services, rail transport, marine transport, air transport, and road safety.
I propose the question that the programs under vote 1091 as read out and sums allocated in the schedule be approved. I see some interest. Member for Garissa Township.
Thank you, Madam Speaker. Madam Chair. May I bring to your attention on the issue of, I think there's a mix-up on transport and road functions here. 1091 is for roads, but when you read, when the clerk read about the functions of this 199 billion, he was talking about rail transport, marine transport, and so there's a mix-up there. And in supporting 1091, Madam Speaker,
What are you saying on Abodeko?
That when the clerk was reading on the functions for this money, or
the
where
programs.
the expenditure for this money will be, he was talking about rail transport, marine transport, and I think that should come under State Department of Transport. Maybe now we need to change that mix-up. Now,
yeah, on Abodeko, give us a minute.
Okay.
Because what you're saying is that the vote is the State Department for Roads. Yes?
The one we are on is on roads 1091.
Yes.
But
allow us to take it again.
Yes, please.
Then we'll give you the opportunity.
Okay.